Weight loss medications are having a moment right now, and the FDA's recent approval of Zepbound for treating obstructive sleep apnea in adults with obesity is big news.
A significant development for sure. This marks the first time a medication has been greenlit specifically for obstructive sleep apnea.
So let's break this down. What exactly is obstructive sleep apnea and what makes it such a serious health concern?
Obstructive sleep apnea, or OSA, happens when your upper airway gets blocked during sleep, and that causes pauses in breathing. These pauses can range from seconds to minutes, and they can occur numerous times throughout the night. While snoring is a common tip-off, many people experience fatigue and daytime sleepiness without realizing they have OSA.
And how does obesity tie into this?
Obesity is a major risk factor for OSA. When there's excess weight in the neck area, it can put pressure on the airway, increasing the likelihood of it collapsing during sleep.
So how does Zepbound address both obesity and obstructive sleep apnea?
Zepbound works by mimicking two hormones that regulate appetite and blood sugar, and this dual action leads to reduced food intake and, as a result, weight loss. The weight loss achieved with Zepbound has been shown to significantly improve OSA symptoms by decreasing the number of breathing interruptions during sleep.
What did the studies on Zepbound for OSA show?
The studies demonstrated some really impressive results. Participants saw a reduction of at least 25 breathing interruptions per hour during sleep, and they lost an average of 20% of their body weight. Even more remarkably, by the end of the year-long study, up to half of the participants no longer met the criteria for having OSA.
That's pretty incredible. What about existing treatment options for OSA? How does this compare?
The current standard of care for OSA relies mainly on therapies like CPAP machines. These machines deliver a continuous flow of air through a mask worn during sleep to keep the airway open, while effective CPAP machines can be uncomfortable and challenging for some individuals to tolerate.
So Zepbound presents a new, non-invasive treatment option.
Exactly. It provides an alternative for people dealing with both obesity and OSA, especially those who haven't had success with CPAP therapy or simply prefer a less intrusive approach.
Can you delve a little deeper into how Zepbound works on a molecular level?
Sure. The active ingredient in Zepbound tirzepatide mimics two naturally occurring hormones in our bodies, GLP-1 and GIP. These hormones are key players in regulating appetite and blood sugar levels. GLP-1 slows down gastric emptying, which helps you feel fuller for a longer period, and GIP enhances insulin secretion from the pancreas, which aids in regulating blood sugar. This two-pronged approach makes tirzepatide a powerful tool for tackling both obesity and type 2 diabetes.
Given its effectiveness, has there been any impact on the medication's availability?
Yes, the demand for tirzepatide has been quite high, leading to supply shortages in the past. The FDA recently declared the shortage over, but it does underscore the need for effective weight loss treatments.
The approval of Zepbound for OSA also brings up the issue of insurance coverage. What's the current landscape for covering weight loss medications?
Currently, Medicare doesn't cover weight loss medications solely for obesity. However, they may be covered for obesity-related conditions such as diabetes or heart disease. This new approval for OSA, a condition directly linked to obesity, could potentially influence Medicare coverage and make Zepbound more accessible to individuals struggling with both OSA and obesity.
What are the different viewpoints surrounding expanding coverage for weight loss medications?
There are contrasting perspectives on this matter. Some advocate for broader coverage to improve access and potentially lower long-term healthcare costs. Others voice concerns about the financial strain on programs like Medicare and Medicaid and the potential for overuse or misuse of these medications.
So it's a complex issue with no easy answers. What about Medicaid coverage?
Medicaid coverage for weight loss medications varies considerably from state to state. As it stands, coverage is typically limited to obesity-related conditions like diabetes or heart disease. Only about 13 states cover these drugs specifically for obesity, making access a challenge due to the high price tag of these medications.
This leads to the question of the potential impact of Zepbound's approval on the pharmaceutical industry as a whole.
Eli Lilly, the manufacturer of Zepbound, is already seeing significant success with this medication and its diabetes counterpart, Mounjaro. This new indication for OSA is projected to further increase their sales and market share.
Could this possibly spark more competition within the pharmaceutical industry?
Absolutely. The success of Zepbound puts pressure on other pharmaceutical companies to step up their game and develop and market their own weight loss medications. This competition could ultimately benefit patients by potentially leading to lower prices and a wider array of treatment choices. The rise of these effective weight loss medications also has broader societal implications. Obesity has often been stigmatized and seen as a personal failing failing rather than a complex medical condition. The availability of medications like Zepbound could help shift this perception by recognizing obesity as a treatable medical condition.
What kind of impact could that shift in perception have on individuals struggling with obesity?
It could empower people to take control of their health and well-being, but it's essential to make sure these medications are used responsibly and ethically. We need to avoid perpetuating unrealistic beauty standards or creating pressure to conform to a certain body size.
So it's more about promoting health and well-being and not fixating on achieving a specific aesthetic ideal.
Precisely. It's about fostering a society that values diversity and embraces all body types while acknowledging the serious health risks associated with obesity.
Let's go back to that alternative treatment for obstructive sleep apnea you mentioned earlier, CPAP machines.
CPAP machines have been the go-to treatment for OSA for years, but they do have their downsides. Some people find them uncomfortable, noisy, or just plain difficult to tolerate. They also require consistent cleaning and maintenance.
Given those challenges, how does Zepbound stack up as a treatment option?
Zepbound offers a potential alternative for individuals who haven't had success with CPAP therapy or prefer a non-invasive approach. However, it's important to understand that Zepbound isn't a cure for OSA. It manages the condition by addressing the underlying cause, which is often obesity.
So if someone stops taking Zepbound, their OSA symptoms are likely to return.
That's correct. It's crucial to maintain a healthy lifestyle alongside medication, including regular physical activity and a balanced diet.
Are lifestyle modifications part of the FDA's recommended treatment plan for OSA, along with Zepbound?
Absolutely. Lifestyle modifications are essential in managing both obesity and OSA. They're a fundamental part of a comprehensive treatment plan.
What are your overall thoughts on the potential of weight loss medications in tackling the obesity epidemic?
These medications hold tremendous promise. They have the potential to not only help individuals lose weight, but also to reduce the risk of obesity-related complications, such as type 2 diabetes, heart disease, and some types of cancer.
They're not a magic bullet, though, right?
Right. Weight loss medications work best when they're part of a comprehensive approach that includes lifestyle changes and ongoing medical supervision. It's about creating sustainable, healthy habits that support long-term weight management and overall well-being.
And of course, there are challenges to consider. Access to these medications remains a significant hurdle.
You're absolutely right. Cost insurance coverage and disparities in state Medicaid programs all create barriers to access. It's crucial to address these barriers to make sure these medications are reaching those who could benefit the most.
So we need to advocate for policies that prioritize access and affordability.
Exactly. We need to push for a holistic approach to obesity management, one that takes into account both the medical and social factors contributing to this complex condition.
It's an evolving landscape, and we're only beginning to grasp the full potential and implications of these medications.
Indeed. It's an exciting time with many possibilities and challenges ahead. The FDA giving the green light to Zepbound for treating OSA is certainly a major milestone. It signals a potential shift in how we approach and manage this widespread condition.
And it opens up exciting possibilities for the future of weight loss medications and their role in addressing obesity-related health problems.
It absolutely does. This approval could really change the game when it comes to managing obesity, and it could lead to the development of new and innovative treatments down the road.
This has been such an informative conversation. Thanks for sharing your expertise with us.
It's been my pleasure.
And to all our listeners out there, we hope this conversation has illuminated the ever-evolving world of weight loss medications and the impact they could have on obesity and sleep apnea. As always, we encourage you to stay informed and consult with your own healthcare provider for personalized guidance and support.